worried about introductions. They begin to sound more like obituaries than introduction. It's.
I talk louder than you do. We're going to move the mic a little closer.
Okay. It's always dangerous to speak or teach after lunch because your stomach competes with your brain for the available blood supply, and your stomach invariably wins. That said, I want to start by taking a step back from the world that we've been talking about, because I think the work you do is amongst the most undervalued, I repeat, undervalued work that occurs. And I think you need a slightly different framework would be useful in thinking about what you're really doing. There's an economy out there that is not part of the GDP, of the gross domestic product. It's called family, neighborhood, community, civil society. It doesn't do much. It just raises children, takes care of the elderly, holds officials accountable, makes democracy work, fights for social justice, and tries to keep the planet sustainable, but nothing important, you understand. So GDP is about building prisons and nursing homes, but keeping people out of prisons and nursing homes doesn't contribute to the GDP. We've got a little bit of problem about what we value and how we value it. Now, I need to say, too, and this may be a little bit controversial, but the economy that I talked about, some economists are beginning to recognize as the core economy. It used to be dismissed as the non-market economy, like it wasn't really market, so it didn't matter. But some economists are recognizing that it's part of that there is a core economy of family, neighborhood, community, civil society that matters. We used to pretend it was infinitely renewable and really wasn't something we had to worry about. Well, we thought the same about the ozone layer until we discovered what we had done to it. And I think we've done a little bit of the same devastation to the core economy, taking it for granted as resilient, infinite in capacity, always able to rebound, and no matter what we did to it, it was always going to be there. Well, what we're seeing is that the old core economy, families are not what they used to be. Communities are not what they used to be. I don't know how many of you even know the names of your neighbors. I think probably when you meet somebody whom you've seen every day for 5 years, you probably ask a really personal question when you see them on the street, like, do you think it will rain tomorrow? Or who's going to win the game? And that's about the level of intimacy and connectivity that we have. And so I think that we're talking about how does one rebuild that core economy. Now, I want you to think of the computer as an image. It's an analogy. It's a metaphor. But we know that on the screen there are many specialized and multi-purpose and powerful programs. But we also know there's something invisible called the operating system. Well, for me, the core economy is the operating system that undergirds every one of those specialized programs. And I don't want to knock the specialized programs, whether it's a specialized healthcare program or a specialized police program or judicial program or the full market economy. I'm not knocking that. But I am saying that that underlying operating system, if it goes down, nothing works. Businesses know that, incidentally, because studies have shown that as people have divided caregiving responsibilities, the cost to businesses has now been estimated by the National Council on Aging at $29 billion. That's replacing employees, absenteeism, partial absenteeism, workday interruptions, elder care crises, and supervisors' time. So when that system goes down, well, let's be blunt about that old operating system. The old operating system was subsidized to a large degree, by the subordination of women and labor exacted from them, by the subordination and extraction of labor from minority groups and immigrants, and maybe sometimes from elders. We've got, what you are doing is building a new operating system with new algorithms. That's not minor. If you think operating systems are minor, talk to Gates, I think his name is, yeah. He didn't think the operating system was just nice, warm, and fuzzy. What you are doing is building an operating system of connectivity and trust and relationships, trust in people, faith, belief, and we've been so busy, all of us, trying to survive, that we've forgotten to dream and to learn how to dream and to understand the magnitude of what you're trying to do. Because it's not just putting Band-Aids in situations. You are trying to strengthen the family caregiver system in a world where families are more and more isolated, where the kids have moved away to another part of town, where, as best I can see from historical stuff I've read, where the oldest daughter is likely to get stuck with the job of dealing with the problems and everybody else is too busy and has conflicts in their schedules. So that you've got a system, we need a significant upgrade of that operating system. And what I believe time banking is an attempt to deal with what that upgrade is going to take. And the first thing I'm going to say is that I've got nothing against money, but I do think that we've got some problems with money. I think we've got what I call a monoculture in terms of what we measure and what we value. So you were sharing your story about a younger child who asked his mother what marketable skills she has. I don't think that's the real question. I think the question is what we value and how we value it. Now, you all know that we determine value by price, that if a thing is scarce, it's more expensive, it's more valuable, that if a thing is abundant, it's cheaper, if it's really abundant, it's worthless. And I suddenly realized that that meant being a human being was worthless. That all of the qualities that enabled our species to evolve, to survive, to build, our ability to talk to each other, to share learning, to comfort each other, to stand up for what's right, to oppose what's wrong, to come together in small groups and take on projects, those are things that we as a species figured out. They're universals. We learned that we could trust each other. We're descended, some people think, I happen to think, from primates who figured out that when the male got killed and the female had to go out foraging, it had to be relatives and extended family, so to speak, who took care of those kids for the species to survive. So we have that wired into us, that ability, and it goes a little bit further back than 10 years or 20 years, okay? So what I'm saying to you is we know that connectivity, that interdependence is real. Yeah, I hear lectures about how you pull yourself up by your own bootstraps. Well, I figure out that I came into the world roughly 9 months in debt, and I've been going downhill ever since. And so I didn't pull myself up by my own bootstraps, And I think that we need to go back to, and what this coalition is about, is understanding that we need each other in a very fundamental way, and that we are interdependent, and we need to create systems that do that. So I created a kind of money that I think is the missing ingredient. I was sharing at lunch what got me doing that. In 1980, I had a heart attack that, according to the enzyme test, blew away 60% of my heart. They said at best I would have 2 good hours a day, and that was 1980, and we had a recession, and I thought, so they're declaring me useless, and they're declaring a lot of other people in Detroit and other places useless. I bet they don't like it any more than I do. And so I said, how do you put people who are useless and to work on social problems that are critical? And I thought, well, we used to use money, and since I was told that the money and the programs were all going to be cut, in 1980, I thought, well, why can't we invent a new kind of money? Well, the reaction to that, and this is before frequent flyer miles and loyalty points and all that kind of stuff, so people were pretty clear that that heart attack had probably gotten to another organ. But nonetheless, they sort of said, well, let him wander loose and see what he can do. So I wandered loose at the London School of Economics and came up with this weird idea. And they said, well, theoretically it would work, but they didn't know whether it would work in the real world. And so starting in 1987, TimeBanks have grown up, and all hours are the same. Now, there are two different kinds of TimeBanks. There's a general kind of TimeBank where you just put in the skills that you have and the things that you're willing to do. And it may be something really difficult, like listening to another human being, or doing errands, or typing, or letter writing, or sewing, or embroidery, or woodwork, or metalwork, or playing a musical instrument, or giving people a lift, or decorating, or simple home repairs, or gardening, or car repairs, or motorbike repairs, or catering, or teaching reading, or adult literacy, or the list goes on. Some TimeBanks have as many as 800 different things that are offered. And that goes into a database, because we don't know what our neighbors can do, and we don't feel comfortable asking them, because we're all taught you shouldn't ask for help unless you're desperate, and then you can buy it by the yellow pages. So a stranger who comes into the house through the yellow pages, we greet as a long-lost brother or sister, but God forbid we should invite a neighbor in whom we're going to see, or a member of the church or faith-based community that we're part of, because somehow it's not, you can't trust those people. You can't trust anybody. We've been fed a whole diet of fear about strangers, and my profession preaches liability, in case you hadn't noticed. And so I think I tell my law students, am I going on? Okay. Anyway, no, I won't tell you what I tell my law students. But I tell you, you can't eliminate risk. Look, it's dangerous getting out of bed in the morning. I mean, it's really dangerous. So if you want to avoid danger, stay in bed permanently. But if you want to get out, you better figure out how to manage risk and then get on with life. I think that part of what we're so one kind of TimeBank is neighbors helping neighbors and putting everything into the pool that they can. Another kind of TimeBank, though, is more specialized. We have unemployed teachers called seventh graders helping third graders learn the alphabet and learn how to read. We have youth who have been arrested now serving on this youth court jury, and they are handling 70% of nonviolent crime by teenagers and reducing and sentencing them to community service, to restitution, to an apology, maybe to a life skills course, and also to jury duty. So it wasn't the good kids judging the bad kids. And they reduced recidivism from 24% to 6%. So I explained to my law students, they're doing more for the rule of law, these bad kids are, than you are. And and then I work with people who are coming out of prison, and they decided they didn't want to be called ex-cons, they wanted to be called homecomers, and they wanted to describe themselves as students. So I said, well, no school will accept you, so they created their own Homecomers Academy, and they get up every morning at 6:30 to provide safe passage to kids across gang territory in Washington, D.C. And so this is a matter of using technology to really begin to use the untapped capacity we have in community to meet unmet needs. And so I would like Respite to be not just a service delivery system, but a catalyst to create and build the kinds of social networks, the kinds of informal support systems that we all have, but that we don't know how to nurture, and we don't like to even overburden them. But if they were earning some credits that they could use, if you'd come, be with my mother who has Alzheimer's for a couple hours, then you could use those credits to get some help from a teenager who could help your kid with the algebra that he brought home that's like Greek to you. So all I'm saying is we need to, it's a reweaving of community, reweaving of extended family, reweaving of trust that starts from the premise. And so I decided I had to say, well, what does that look like in terms of rewriting the operating system? And it starts off with all hours being equal, and every hour spent in even these specialized programs. We had specialized programs with HIV and AIDS and folks who, and there were, I would call them 5 core operating principles, 5 core values. And the first one is that everybody has something to give. Everybody can be a builder and a contributor. Even a bedridden person can be part of your quality control system. Even a bedridden person on phone can nudge somebody to take their medication and check whether they fulfilled the regimen that was prescribed to them. And we ought to assume that we can find something that they can do that we can celebrate. The second principle is we need to redefine work. Work has to be redefined to include whatever it takes to rear healthy children, to preserve families, to make neighborhoods safe and vibrant, to care for the frail and vulnerable, to redress injustice, and to make democracy work. You know, we didn't break, the sit-ins were not done by people earning minimum wage. We didn't stop apartheid by folks on stipends. We stopped bad things from happening because we turn out and we put in that labor. And I think we're inheriting a world that divides us between paid staff with marketable skills and people called volunteers. Well, volunteers are workers, folks, and we needed a currency, I thought, that honored that work and that could link them to enhancements in their quality of life and in what they did or what their families could do that made a difference. Work means you record it. Work means that there's some way in which you accumulate it. And work means that there's some way in which it links to some kind of enhancement. Maybe it's a trip. Maybe it's a concert. Maybe for some of the families downtown in Washington, D.C. who have never been to a museum, maybe it's a trip to that for them. Or maybe it's in some TimeBanks, it's discounts that merchants give, like you get a discount if you're a member of AARP. So all I'm saying is there are ways in which we can create rewards that reinforce and validate what they're doing. I'll simply, the third value is reciprocity. Giving is more powerful as a two-way street. And to avoid creating dependency, acts of helping must trigger a giving back by helping others. You need me becomes we need each other. And so the notion that we can avoid dependency by saying the best way you can pay me back is by helping somebody else. And then we need to create linkage systems for that, because people say we'd like to, but then they don't know what to do. But if we create linkage systems, and that's what time banking is, but time banking doesn't have a monopoly on that. There are lots of community groups, lots of faith-based groups, lots of college groups, but all I'm saying is we need some way to advance a sort of pay-it-forward system. The fourth value is community. No man, is an island, but informal support systems, extended families, social networks are held together by trust, reciprocity, and civic engagement. Putnam says social capital is going down, but he doesn't tell us how to build it back up. I'm telling you, you can build it back up by setting in motion a system of mutual dependence and something really weird like a birthday party each month for a group of people, or all of whom had a birthday that month, or potluck. There are ways we know how to do that. We're a species that sort of knows how to celebrate and create events. And so I think that creating those kinds of initiatives, maybe we should have an initiative a month where we say this month nobody coming out of hospital is going to be without somebody who will run errands for them for 2 weeks. Maybe we'll say no third grader ought to go into fourth grade who doesn't have reading ability because we know what pathway that sets them on. In other words, we can create our own projects, and it's not just about individuals. Collectively, we can make those kinds of decisions. And the fifth value is respect, and then I'm saying that's part of what's built in inequality, but it's part of amplifying the voices of people who are silent. Those who receive the care, the families themselves are silent, and sometimes that means listening to people who tell you things you don't want to hear, like telling you the truth that this isn't working, that I don't want you doing this, that I really would rather go out than be kept in. we need. That respect means listening and amplifying the voices and creating forums where people can speak collectively. And the technology can all help us. I think that what I would want to say is, if there is any group that gets that understands how basic the operating system is that you're talking about, that I was talking about, how basic it is to upgrade that. You think of what the upgrade is. You know, you all know about one medium of exchange that we don't talk about, and it was being used. They're called grades and academic credits. That's what we pay students for their work, okay? And so you were saying, let's use that as a way of paying students in the various professions and schools to be part of the workforce. Well, I'm saying time banking is another kind of currency that you can use to pay people, and that kind of an upgrade and that kind of a workforce can involve every human being on the planet. We need that. And when I got tired of writing essays and articles, I wrote a meditation that says, we stand for what it means to be human, and human beings are not chattel. There are domains which are above market, beyond price: family, loved ones, justice, democracy, our planet, all that is holy, not for sale at market price, at any price. 1 hour is our piece of eternity, fleeting but nonetheless precious, sacred, eternal. That is what time banking means, declares, affirms, and reaffirms. We are and we will not be diminished. Let it be. Thank you.
In the short time I have here, I want to tell you about the respite programs that we've developed in Tennessee. We have been working on the underlying operating system, as our inspiring speaker we just heard does. But we have been developing a system of respite services for families with mental health issues here in Tennessee. It's been understood for quite some time that families should be involved in services for children with emotional disturbance. However, until very recently, this involvement usually consisted of families participating in treatment or undertaking behavioral programs to change or stabilize their children's behavior. This is good, but in general, the development of support services for these families, including respite, has lagged behind the development of such services for families of children with other types of handicaps. The fact of caring for a child with an emotional disturbance was not always understood as stressful for family members in the same way as, say, a child with a physical handicap. This, unfortunately, overlooks some of the realities faced by the families, and I was going to flash this slide. Not only will I never babysit for you again, it's going to cost you $100 to keep you from squealing to the other sitters about your kids. This is what they face. The behaviors of these children often lead to problems with people in community settings and problems within the family, including marital strain, parents' health, and hampering the ability of parents to socialize with others and thereby to get relief from caregiving. Parents may also feel embarrassed, guilty, or angry about their child's behaviors. There's research on this. Brannon and Hefflinger have described these objective and subjective sources of caregiver strain in several studies. Children with emotional disturbance are often placed out of the home because their behavior problems can be overwhelming to the family. A study by the Chesapeake Institute for the U.S. Department of Education found that students with serious emotional disturbance are more likely to be placed in restrictive settings and are more likely to drop out of school. Their families also were more likely to be blamed for their child's disability. For those not in the mental health field, I need to define the term serious emotional disturbance. A person with a serious emotional disturbance is defined as a person from birth up to age 18 who currently or at any time during the past year has had a diagnosable mental, behavioral, or emotional disorder of sufficient duration to meet psychiatric diagnostic criteria that results in functional impairment which substantially interferes with or limits the child's role or functioning in family, school, or community activities. Some diagnostic labels for children may include conduct disorders, anxiety disorders, bipolar disorder, obsessive-compulsive disorder, or psychotic disorders. some behaviors which may be seen in children with SED. These behaviors interfere with the child's relationships with other people and their ability to interact appropriately with their environment. These behaviors may include aggression, self-injury, hyperactivity, withdrawal, abnormal mood swings, distorted thinking, excessive anxiety. It is important to note that many children without SED may exhibit some of these behaviors at some point in their development. The difference for children with SED is that the behaviors continue for a long period of time, demonstrating an inability to cope with their environment or peers. These characteristics may make it difficult for parents to access family and community resources, which ordinarily provide parents with a chance for a break from caregiving responsibilities. As I noted earlier, we have data showing the stresses and risks associated with a child's having an SED. We also have data on the positive effects of respite for parents. Data from an outcome-based evaluation study by Wade, Kirk, Edgar, and Baker show that respite may reduce the likelihood of divorce and help sustain marriages. A study of Vermont's respite care program for families with children or adolescents with SED found that families in the respite program experienced fewer out-of-home placements and were more optimistic about their future capabilities to take care of their children than families which did not get respite. These studies indicate that respite is important in preventing parental burnout, in maintaining the integrity of the nuclear family, and reducing the likelihood of out-of-home placement for children. So, how do we provide respite for these families? Well, you may ask. Just as the stresses created by these children for their families are qualitatively different from the stresses posed by other handicapping conditions, so are the types of skills needed to intervene. It's fairly obvious that a family whose child is medically fragile or has a physical handicap needs a respite provider with skills to deal with that condition. You're not going to be much of a help as a respite provider for a child with a feeding tube if you don't know how to handle a feeding tube. This is just as true for a family whose child has SED. Respite providers for mentally and emotionally handicapped children must be behavior managers as well as child care specialists in order to provide successful, affirming care experiences for child and family. So, what did we do about this in Tennessee? In the late 1980s, Tennessee's mental health policymakers understood the importance of respite services for families whose children have an SED. Few respite resources existed at the time. Interestingly, Tennessee has had a history of non-traditional services to this population. I reference particularly the RE-ED model developed by Nicholas Hobbs. The RE-ED model, for instance, had an emphasis on family involvement in ways which did not stigmatize the parents or the child. We take for granted today that services shouldn't stigmatize the family, but this was by no means a given in the 1980s. Our familiarity with such programs meant that Tennessee was well positioned to develop a non-traditional model for respite. So, I'm going to describe how we built a model planned respite program here in Tennessee. To the extent that any models existed for respite for families with children with SED, they were for overnight placements of children in situations of severe crisis. Even when these families are not in crisis, we know they need a break. We've talked about that all day. We wanted to develop a model that would apply to families' everyday experience. In 1988, when federal funds became available to support respite, the Department of Mental Health applied for and received a grant from DHHS Children's Bureau to develop this model. For the first planned respite development grant, we called in a group of professionals who had been involved with the RE-ED program to help us develop the model and to pilot a planned respite model program in Murfreesboro. After the first planned respite program was initiated, a second Children's Bureau grant allowed us to replicate and implement the planned respite model in 2 rural counties. A third grant in 1990 enabled us to test the feasibility of a less staff-intensive structure, which was implemented in Knoxville, Murfreesboro, and Memphis. Because the planned respite programs showed such success, and they were not horribly expensive to implement, the Department of Mental Health was able to continue to fund them as each graduated from federal funding. This shows a great avenue towards sustainability, potentially. Not only did they fund the programs which had graduated from federal funding, but we continued to fund additional programs across the state. In 1999, the Department of Mental Health added 3 more planned respite programs in Crossville, Nashville, and Chattanooga, and later added 2 more programs in Jackson and Johnson City. This had a total of 8 programs across the state, and reading from west to east on the slide, they were in Memphis, Jackson, Gallatin, Murfreesboro, Chattanooga, Knoxville, and Johnson City, thus forming a whole... Whoa! No! Sorry! I'm new to clickers. Oh, dear. Okay, here they are, west to east. Okay, now you got them. So we had a system of planned respite programs all the way across the state, which was wonderful. So now I want to tell you about the model and what exactly that is and does. The planned respite program model was developed to provide services which are intended to maintain the family by enabling the family to find or develop ongoing respite resources. This ongoing respite can help to prevent the placement of their children outside the home. The planned respite programs serve families whose children are 2 to 15 years old who have a diagnosis of SED or autism. For the younger ages, where children, we hope, are not yet diagnosed, we allow entry into the program based on their Achenbach Child Behavior Checklist score. The 3 goals of the program are to give the parents some direct respite, to teach the parents how to find and train their own respite provider, or to identify and learn how to access community resources, and 3, to keep the child in the family instead of out-of-home placement. This planned respite model is based on the principles that respite needs are best defined by the family, parents are the experts in their children, home and community settings are preferred as respite venues, and parents need some immediate direct respite before they can begin to focus on how to obtain respite in the future. The components of the planned respite program model are we employ a professional person called a respite consultant with expertise in behavior management to help families assess their respite needs, develop a plan, and implement respite activities. The model is a relatively short-term service that starts by having families define their own respite needs and come up with an individualized family respite plan. This is family-directed respite. Based on this plan, the respite consultant, assisted by volunteer or professional staff, paraprofessional staff, provides some direct respite for the parents as requested and helps the family to identify possible respite resources in the community or in their social network. The direct respite provided, as I mentioned, gives parents a break from caregiving. This lessens their stress and allows them to give attention to developing the skills necessary to find and to train their own respite provider, or to find an accessible community respite resource. The direct respite may consist of outings with a child in a community setting or facilitating the child's participation in typical activities such as sports or after-school programs from which they may have been previously excluded. From this work, the respite consultant determines what behavioral strategies may be needed to address the child's challenging or difficult behavior in that setting. Although behavioral intervention is not the main element of the program, respite consultants are trained in the ABC model, a fairly simple and very versatile behavioral model developed by People Places in Virginia. This model can be used to develop and suggest strategies in those situations where challenging behavior must be addressed in order for the child to function in the community setting. The respite consultant also assists the family in learning how to find and train a future respite provider for ongoing respite or to develop ongoing respite resources. The behavioral strategies developed during the direct respite outings are taught to the parents, and the parents then can use these strategies in their training of the respite providers they identify and hire after they leave the program. This model enables families whose children have SED to get needed respite on an ongoing basis. In the last fiscal year, the planned respite program served 262 families with 321 targeted children with SED in those families. Some families had more than one child with an SED diagnosis. Of the families that completed the program, 99.5% of the children remained in the home. So we were effective in preventing out-of-home placement. Preliminary analysis of data from the outcome evaluation questionnaire given to families indicates that the caregiver stress was reduced since after the respite was provided. Also, caregiver relationships with the spouse, other family members, and the child were also less strained. Beyond the quantitative results, the experience of the families speaks to the power of the model. For example, one parent said, "I had no idea how to look for respite. After enrolling in the respite program, my respite consultant gave me some ideas where to look for people who might provide long-term respite, and I actually found 2 at my church. She taught me that people should know about what people should know about my children and how to train people to meet my children's needs. She even helped me apply for money to help pay for long-term respite. Without this program, I would never have known what to do or how to do it." In another family's experience, an East Tennessee family adopted 3 young children, all with SED or MR. They did not realize the level of effort that would be required when the children got older and their problems and care needs became greater. When the mother came to the planned respite program, she was at the breaking point, so much so that she was considering sending them to a group home for care. The program was able to give the mother respite and some time to relax and to spend so much needed time working on her marriage. She and her husband were able to get into some couples counseling to have some time to themselves during their respite time. The respite program set the family up with a behavior chart reward system to help with some of the children's behavior and to get the children involved in an after-schools program to help give them some respite time. They helped the parents to get the children into a summer camp, giving the parents a chance to go on vacation, something they hadn't been able to do in 10 years. To date, the children are doing well, and the parents have been able to maintain their marriage and have some continuing respite. This is the planned respite program in a nutshell. Now let me tell you some of the other things that we've done in Tennessee to develop a respite service system. What we wanted to do was develop a whole system, if we could, that would for this population. The Tennessee Respite Coalition, our hosts today, were founded by an interdisciplinary group of volunteers and professionals, including the moderator of this panel. It became obvious that operations couldn't continue and grow with members serving only on a volunteer basis. That group, including Department of Mental Health staff, wrote and obtained a coalition development grant awarded to the Department of Mental Health to hire a coordinator. This served as an incubator for the Tennessee Respite Coalition to develop and grow, and eventually to become a nonprofit organization after the grant funding ended. Following the establishment of the planned respite programs, the department in 1996 received a grant from the Children's Bureau to establish a statewide respite information and referral toll-free phone service. This respite has morphed into what is now called the Respite Helpline and continues to be implemented through the Tennessee Respite Coalition as part of both the Respite Voucher Grant from the Department of Mental Health and Substance Abuse Services and the Lifespan Grant. To address the need to help parents pay for respite, the Department of Mental Health and Substance Abuse Services funds the Tennessee Respite Coalition to provide respite vouchers to families whose children have an SED or autism. The TRC also serves as a comprehensive focal point for cross-disability, cross-age respite services in Tennessee. I'm proud to say that the Department of Mental Health and Substance Abuse Services has continued to fund all of the planned respite programs and the TRC Respite Voucher Program after their federal grants ended. This commitment to and decades-long sustained funding of respite for families whose children have an SED shows a deep understanding of the importance of respite as a crucial family support service. And may I say that none of this would have been possible without the federal grants, which initiated the development of the model and the continuing efforts in that. So I want to express our appreciation to the federal government. Tennessee also, if some of you may have attended a workshop yesterday on the crisis respite service, which is another avenue toward respite for our population of families who have mental health issues. That crisis respite service was in a workshop yesterday. While there is still much work to be done in increasing funding in Tennessee and a cadre of respite providers, we have the bones here in Tennessee of a comprehensive respite infrastructure system in place, with a central point of respite information and referral, an advocacy body, a lifespan perspective, and several funding sources for respite care for persons caring with various disabilities and health conditions. The Department of Mental Health and Substance Abuse Services takes particular pleasure in having developed and funded the innovative planned respite and crisis respite models for the population of children and adults with mental health needs.
Thank you.
Thanks, and thanks for having me. When I sent my slides in to Jill, she sent me a really nice email and said, are you going to be able to do this in 15 to 20 minutes? So I think that was her way of saying, well, that's a whole lot of information you're trying to cram in here. So it is, my presentation is full of a lot of information, so just bear with me. I'll get through it the best that I know how, but this is something that's really exciting here in Tennessee, this project that we're a part of, and I'm so thankful that I'm able to come here and share some of the things that we're doing here with this group, and hopefully if one of your states is involved in the project as well, you can go back and connect with them and help teach them some things about supporting families. But as Carol said, I am a native Tennessean. In case you can't tell, I've tried to lose the accent, but it's not going anywhere. I actually got to go to Sydney, Australia in last December, which is somewhere I wanted to go my whole entire life, and I checked in at the hotel, and the man at the desk said, "Are you from the South?" And I was like, "Really? Are you kidding me? How much further south can you get than Australia?" And he said, "No, I just finished watching Justified on Netflix, so I recognize your accent." He said, "Is it really like that in the South?" I said, "It's exactly like that in the South." I've never seen that, so there's no telling what he thinks, but anyway, so... Again, thanks for having me, and I hope you've enjoyed your time in Nashville. So this project is sponsored by the Administration on Intellectual and Developmental Disabilities. It's a grant that came to Tennessee, and the grant came to the partnership of our department, DIDD, and the coalition. Not the coalition, but the council. Our national partners are NASDs, which is the National Association of State Directors of Developmental Disability Services, HSRI. You can see all that. I won't bore you reading that. So this project was kind of the vision or the dream that came out of a meeting that we refer to as the Wingspread Report. In 2011, a national agenda came together with about supporting families with a member with intellectual and developmental disabilities. Their dream was to develop and fund a national supporting the family initiative, which wasn't always the same as what we all know as family support services. So one of the first things we had to get over in Tennessee when we started working with this project, when we talk about supporting families across the lifespan, is to understand it includes what we traditionally know as family support services, but it's not the same thing as family support services. The goal of the project is to build capacity within a community of practice across and within the states, create policies, practices, systems to support families and assist families with a family member with an intellectual or developmental disability. So, and across the whole lifespan. And that was a new lens for us here in Tennessee. We've always concentrated so much on the person, being person-centered, and not that that's not important, but you have to look at the person within the family too, to be able to support them successfully across the lifespan. We're looking for state and national consensus on the national framework and agenda for improving support for families with members with intellectual and developmental disabilities. So there's no real way of doing this. There's no best practice that's been discovered yet. I've been parts of community of practices before, and it's kind of like, okay, here's the best practice, so go out and try it in your state. There's not really that model yet. There's not really that national framework, so that's one of the things this project looks to do. We're looking to enhance national and state policies and practices and systems that result in improved supports to families, and capacity of states to replicate and sustain exemplary practices to support families and systems. So it's a 5-year grant that we're involved in. 6 states were awarded, and we're fortunate enough to be involved in a community of practice, and it involves the state's DD agency and their DD council. The 6 states are Connecticut, D.C., Oklahoma, Tennessee, Washington, and Missouri is a mentor state. So most of the work and the conceptualization for this project came from the university in Missouri. And of course, the community of practice is a group of people coming together to look at barriers, learn from each other, and figure out what's the best way to move forward towards a common goal. So supporting families, the project is defined as a set of strategies targeting the family unit, but that ultimately benefit the person with a disability. And you heard Sharon Lewis talking about how important that was yesterday to support the families. You heard my two colleagues on this panel talking about how important it is to support families and sustain families. Because we have to recognize that the people exist within the family system. I'm big on being person-centered and am so excited about the new rules from the federal government about person-centered planning and person-centered practices. But if you really want to look at being person-centered, you have to recognize the person surrounded by the family. So again, it's a bit of a different lens. When we're looking at the person, we want to look at self-determination for the person, independence for the person, integration for the person, and inclusion and building that social capital for the person. And then for the family, how do we support them to stay together, to be healthy, to be mentally healthy? What supports do they need so that they can nurture, love, and support their person to achieve their life goals? Why are we looking at families? I think we've heard statistics over the last 2 days that answer that question. But, you know, families are connected biologically, they're connected socially, they're connected at all policy levels, and they're connected environmentally. And the national statistics show us that of the 4.9 million citizens with developmental disabilities in the United States, 75% of them get no paid services. So how are those people being supported? How are their families taking care of each other? Those are the people that we really need to learn from because they've obviously got it figured out. So those are the people we're trying to bring into part of this community of practice on a state level to figure out what kind of things do you have going on in your life. What works for you? What informal supports works for you? How are you staying together? And what might you need in the future to sustain your family? So families are providing care to the vast majority of people with disabilities, not only in Tennessee, but around the nation. We all know that the state and federal funding is diminishing, and if it's not diminishing, we're expected to do a lot more with the same amount of money. We have huge waiting lists here in Tennessee. We certainly have a huge waiting list and no hopes of getting more funding, so we have to figure out another way to support people and their families. There's a big impact with the baby boom generation. They're taking care of their parents. They're not always available to be part of the caregiver pool. And our traditional caregivers may now be in need of their own long-term supports and services. So when we talk about supporting families, one of the things that's a little different is we call this supporting families across the lifespan or the life course. And it's looking at a person outside of their disability. This isn't just for people with disabilities, this is for looking at all people. Because when we're looking at supporting a family and supporting a person, we have to understand that life is a journey. Things change on a day-to-day basis. You have to have a vision. Anything is possible with the right vision, and everything is connected. I'm just echoing what you've heard today. How do we connect each other? How do we connect to our communities? And we have to remember our overall compass for people and their families and their quality of life. Again, this is just a slide about some of the guiding principles for supporting families and talks about catalysts. What kind of things are happening to cause change in the way that we support families, values, leaderships, listening to self-advocates and their families, and then what can we do to get to that outcome? And of course, across all of these principles is partnership. One of the things we want to do when looking at the life course is talk about self-determination. And in our field, it seems like we wait and talk about self-determination when a person's leaving high school or transitioning into that adulthood type age. But we have to start thinking about self-determination with families when a child is born. What are your hopes and dreams for your son or daughter? They need to be the same as anybody's son or daughter's dreams. And the arrow you see pointing here is what we call the trajectory. That's the trajectory we want to help families set their son or daughter on, and that's the non-disability trajectory. It's what are the same things that what do you want to accomplish with your life, and help families dream and hope for the same outcomes for their son or daughter's life as people without disabilities or as children without disabilities. And when you have a baby, you don't sit around and think about, well, my dream is for my son to live in a group home when he turns 18. That's not what you talk about. So how do we help families with children with disabilities get away from that kind of thinking and understand there's more out there than what we've been used to in the traditional services? We look at different types of supports in the Supporting Families grant. We look at relationship-based supports, and that's family, friends, neighbors, church members, co-workers, the people that live in your community. And we talk a lot about technology-based supports. What kind of things can we use that from iPads or iPhones? What kind of supports and services, non-paid, paid, from those services can we use? And then community-based supports, schools, public transportation, businesses, churches. What are those supports available? And then, of course, the specific disability supports. And we all know what those are. We look at charting the life course in terms of uncharted possibilities. And so when you think about the different areas in your life, employment, community living, social and spirituality, healthy living, safety and security, citizenship and advocacy, supports for family units, and supports and services, we talk about the chartered services and supports, which are those on the bottom. Those are the traditional things that you think of services that we provide to people with disabilities and their families. And then you think about the slightly chartered services, kind of the more innovative, newer ways of thinking when we're talking about support employment, semi-independent living, in-home community services with their parents. But we want to learn more about the innovative supports or the unchartered services and supports, because things have changed over the last 30 years, and that chartered row is kind of a dated way of thinking. So what are the unchartered possibilities for people with disabilities, for anybody? How can we use technology to help support people? How do we connect people to careers, competitive employment? How do we help people with disabilities go to college? Those are the kind of possibilities that we're trying to figure out how to support here in Tennessee and across the nation. So our approach has been change the culture of our service system from one that provides programs to one person to one that supports families. And as you heard Sharon Lewis talking yesterday, that's totally radical for a bureaucrat, because we're used to only paying for something or providing something that affects this one person. Now we're having to figure out how to support an entire family because it affects this one person. Can we begin thinking creatively about policy and systems change? I'll have to tell you, this whole project we've got a long way to go, don't get me wrong, but the conversations at the state level because of this project have changed drastically. We are in the middle of a renewal of two of our big waivers, which funds the vast majority of our programs. And the conversations we've had for renewing those waivers have been a lot about, okay, so how does this support the family? How does this service support the family? Or are we creating a barrier for families? So it's really changed the way that we've discussed things. Maybe not, we haven't gotten there yet in the way that we're doing business, but it's certainly changing the culture. And can we think about innovative rather than expanding the current service? We have to think of new ways to do business. And in Tennessee, we have an estimated almost 103,000 people with developmental disabilities, and 85% of them are getting any paid services. 7% of them are on our waiting list, our DIDD waiting list, and then 8% are all that's getting paid services. So that slide just emphasizes that we have to find another way to support families and ultimately people with disabilities. One of the things that we've learned through this community of practice, and we're trying to pay a lot of attention to, is that if you look at disability services, the circle on this side, you'll see that traditionally the person with the disability is the center, and then they're surrounded by disability services. Those disability services, what are they doing between that family and community circle and the family and the community circle. Can you see what that circle's doing, that disability or social service circle? It's actually separating the person from the very thing that we're trying to do, which is connect them to their communities and support their families. If you have a 24-hour staff person assigned to you all the time, how hard is it going to be for you to connect with your family or make real connections in the community? So we're having to rethink the way that we provide even paid services to make sure that we have real lives and real people, and that those social services are just dotted in those circles instead of separating people from the circles. So we're trying to learn from families, not just the families who are receiving services, but the families who aren't, trying to figure out what are they doing to be successful in their communities. We are trying to improve services and supports to all families, changing what we define in terms of what are supports, what are they, who receives them, and how do they contribute to achievement of important life outcomes. We're looking at our policies and systems so that we can support achievement of important life outcomes in pursuit of life aspirations. And support should always contribute to the quality of life for people with disabilities and their families. We're looking to make services more effective and less intrusive. And our vision is that people will have access to resources and supports across the lifespan, that are person and family-centered and directed, that they'll have opportunities across their lifespan to be full citizens in their community. And so we're going to support each other through sharing our experiences and knowledge to increase community belonging. This is just a different vision for supports, and traditionally we would only look at the day-to-day needs when it comes to supporting families and supporting people. So moving forward, we're trying to figure out how to consider discovery and navigation, emotional supports, which is what Dr. Barnes referred to, and of course the day-to-day supports and needs. Typically, the disability service system only addresses one piece of this framework, which is the day-to-day needs and instrumental supports. So how can we ensure families have access to all three types of supports throughout the lifespan to ensure they have the capacity to care for their family member with intellectual and developmental disabilities? So the service system should focus to support families who care for family members with intellectual and developmental disabilities. So we've got to figure that piece out. Crisis intervention is important, but helping families with planning for the future to avoid crisis is also critical. We need to coordinate supports and services throughout the individual's entire lifespan. We should always include people and families in participating in evaluating and planning their services. We need to help families become engaged in helping other families. Provide training to community organizations so they can be more effective in providing needed supports to families. So that's some of the things that we're trying to do here in Tennessee. So far, our progress in the first year of the project is a really easy thing, not easy, but one of the pieces of low-hanging fruit, for lack of a better way to describe it, that the department could grab onto was our waiting list. And how do we interact with families and people with intellectual and developmental disabilities at the front door? When they come to us, what kind of information are we providing to them, and what are we telling them, and what are we doing other than saying, oh, we have a waiting list that's 8,000 people long, we're going to put you on the waiting list. So we've looked at that process, and we have a work group that is including families that we're going to use the life course information and decide what pieces of information we provide to families based on where their son or daughter is in the life course, and how we can connect them to other families and other people in the community so we can actually offer people some support other than just placing them on the waiting list. So that's kind of helped us reframe how we think about the case managers who work the waiting list. And we're working hard on building on community resources. We've found tons of homegrown, family-grown, family-to-family networks, and figuring out where those are and in these little towns and connecting other people to them has been an amazing process. So we've worked a lot on that. The DD Council's done a lot of work on communication. There's a monthly newsletter. There was a Breaking Ground edition. There is their magazine that talks all about families and supporting families. We have a resource folder that we hand out a lot to people on our waiting list. The council has them. They're handing them out all over the state. It just talks about resources for people along the life course. And so we're looking forward to seeing what we learn in the coming years. We're trying to figure out, what are our current strengths? What supports are working for families, and how can we replicate those across the state? How can we not be a barrier to supporting families and instead be the actual support across Tennessee? So I know that was a lot of information, but the message is we have to rethink our framework. We have to figure out how to support families to stay together. We have to figure out what's important for the person with a disability and build all kinds of supports around them, including supporting the family for the future. And here are some resources if you want to learn more about the project. The first website, you can go there. There's tools for planning. There's all kinds of information about what the different states are doing. It's a great resource if you want to use that. And then the other two are just our local agencies that are involved in the project. So thank you for your time.